atrium, causing the left atrium to stretch, grow, and enlarge to accommodate for this extra back pressure. As that left atrium enlarges, two things happen. One is the left atrium can't compensate anymore, so that pressure continues to back all the way up here into the lungs. And we call that left-sided congestive heart failure. That's when fluid builds up in the lungs and dogs start coughing all the time or having heavy breathing patterns. But when the left atrium enlarges so much as well, it sets up a scenario where we can have these arrhythmias that cycle out of control, and she's gone on to develop atrial fibrillation. Okay? Those are the two consequences of this valvular issue. Now, we can't do anything to go in or fix the valve. There are a few groups that are attempting valve surgery and repair, but realistically, we need to address this, and your vet's already done a great job about, one, removing the fluid from the lungs, and two, improving her heart muscle function, and three, trying to control her arrhythmia. Okay, and we're doing two of those three things currently. One, I don't hear any fluid in her lungs today, okay, and that's because she's on the Lasix.
Right.
The Lasix, however, is a diuretic that causes a lot of peeing and drinking, okay?
Right.
So that's essentially removing that fluid from the lungs. But as her heart rate's so darn fast, her ventricular function has declined. So she's on Vetmedin as well. That medicine improves her heart muscle function. Now, her other medicine, diltiazem, is a medicine that is trying to control her atrial fibrillation rate, and it's still not well controlled, okay? So I know it's kind of crazy getting like the capsules and then breaking them up and then doing the 2 capsules, and I do think that's a good idea. She just on that twice a day. But I would start her on an additional medicine called digoxin. So digoxin and diltiazem used together is the best combination to control her atrial fibrillation rate.
Okay.
Her heart rate today is around 200 to 250, and it should be ideally like less than 160 in the hospital.
Okay.
Or even at home listening, we want it to be closer to 100.
Right,
okay?
and that's what it has been. I've
Okay.
been.
Yeah, I'm glad.
But she's calm.
Yeah, but I do think that the medicine is also supposed to keep her heart rate down when she's active. So
Okay.
I'm glad when she's calm, it's improved, but we do like, the more excited she gets, and given her breed, there's going to be breakthrough periods where she gets excited. We do need to better control the heart rhythm, but you're doing a good job of monitoring that at home. But let's just start this one additional medicine.
Okay.
And then, when was she started on all the medicines again?
It would be like a week ago.
It's just about a week, okay.
Yeah, she came to the emergency room.
Yeah, so I would just start digoxin, and then I'd start one additional medicine called spironolactone. I would start it in sequence, meaning I would start digoxin first and make sure she's not getting any stomach upset or diarrhea or anything.
Okay.
And then a few days after, we'll start the last medicine, which is spironolactone, which helps reduce salt and water retention.
Okay.
This is very important for long-term management of congestive heart failure.
Okay.
Now, one thing I'm noticing is that her heart function is declined. Now, she's on Vetmedin, so I worry that this is even on Vetmedin, the medicine that improves function.
Right.
I worry that her heart function is starting to fail. That can be from one of two things. It can be from her heart rate being way too fast. That's a condition called, so her underlying disease is called degenerative mitral valve disease. But she also has heart dilation and poor function. So this phenotype is called dilated cardiomyopathy. In Latin, that just, in English, that's Latin, but in English that means heart muscle enlargement problem.
Okay.
This can either be from too fast of a heart rate causing this cardiomyopathy, so it's tachycardia-induced cardiomyopathy from having a fast heart rate. Or it can be nutritional. She could have developed this poor function from having an inadequate nutrition. In fact, some of the biggest diets that are causing this that we've been seeing recently are dogs that are on diets that are grain-free, but particularly diets with high peas and chickpea and lentil counts, okay? Her current diet does have peas and chickpeas as part of the first 5 ingredients. If this is nutritional to some degree, we can improve that.
Okay.
But I would consider switching her diet.
Okay.
I know she has food allergies, so maybe switch to something that's not chicken-based, but something that doesn't have peas or chickpeas in the first 5 ingredients.
Okay.
Because those chickpeas and lentils actually inhibit the absorption to the heart muscle or the myocardium.
Okay.
They inhibit the absorption of taurine, the most important amino acid for cardiac health. So the last thing, and I don't mean to add to this laundry list, but the last thing I would add is a supplement called taurine.
Okay.
Taurine supplementation has been shown to improve heart function if she, for some reason, is having this nutritional dilation of her heart muscle. Okay. The last thing too, and I don't even want to do this right now, is considering fish oil supplements.
Okay.
Can sometimes be helpful for the skin and also the heart. Okay. That will be weeks down the road if we.
Right.
I don't want to add too much because these are already a lot of medicines, but I'll type a fish oil dose for you in your report just to reference if you eventually want to start her on it.
Would cod liver oil?
Yeah.
Okay.
She already on that?
I am.
Okay.
I mean, I eat cod liver and there's oil in the can, so if I dribbled a little on her
You
kibble.
can. So I'll type a report out for you and your wife, but I'll also have like an omega fatty acid, which is in the oils, and I'll have the dose for her. Okay. It's going to be a little different than you and I, so I'll just provide that dose. The best way to make sure that her heart rate is controlled over time is one, what you're doing, taking manual heart rates at home, which is good. But two, the best way to do it would be to do a 24-hour ECG or Holter monitor.
Right.
Okay. When she's playing, when she's sleeping, when she's in the car, when she's doing her routine, when she has zoomies, when she's eating, when she's going potty. I want to know what her average heart rate is in an entire day.
Right.
So we would actually have you come in like a month or so and put a vest on her, and then you would have a diary and you'd say, okay, here we go, Zoe's sniffing or she's sleeping, and then I just know throughout a whole day exactly what her routine is, and I want to ensure that the heart rate is not too out of control.
Okay.
That's the best way to make sure we don't need to adjust the medicines, okay?
Okay.
Because keep in mind, when she comes in to see me, her heart rate's probably going to be the fastest it's going to be.
Right.
But I don't want to keep adjusting her medicines every time without. I need an average, okay? So that will be the next step if that helps.
Yeah.
Now, do you mind in like maybe a week or two going back to your veterinarian to check her kidneys?
Absolutely.
Yeah. These medicines are safe, but they are not completely benign.
Right.
They're going to make her kidneys expel more water, so she's going to urinate more.
Okay.
Her kidneys are kind of working overtime, and I just want to make sure it's not too much for her, okay? If she were to go into kidney failure, God forbid, or something, you would notice she stops eating completely, or she becomes lethargic and nauseous, but all things considered, it sounds like she's still eating well, but I do want to just check those kidney numbers roughly in 1 to 2 weeks, okay? When we go into atrial fibrillation, we lose a lot of our heart output, or blood pressure decreases, and that's when dogs often start collapsing, okay? Now, when we control the heart rate and we control the fluid buildup, collapsing episodes become very infrequent.
Okay, good.
Mostly with excitement and activity.
Right.
So just keep those things in mind, okay? But in a nutshell, that's exactly what's going on here and the medicine she will need to be on. Now, one question you may have is, what are we looking at kind of prognostic-wise or long-term here? Usually with this condition, once we develop AFib, we typically have like 6 to 12 months of prognosis, okay?
Okay.
I'm sorry, I know it's
understand.
not,
I understand.
Just, that's what we see on average. With these medicines, most importantly, will keep her quality of life very good, okay? So I'd rather have 6 to 12 months of excellent quality of life than 2 years of collapsing every day and those sorts of breathing problems, okay? Dogs surprise us all the time. I think on the medicines, we may have a chance to do better than that, but I do want to be honest about what we normally see, okay?
Yep, got it.
So I hope that helps.
Yes.
If you or your wife have any other questions, she can contact me also. But at this moment, do you have other questions for me? I know you may need a pharmacy to call these things into and everything.
Yeah, they can't supply them here.
We can get them here.
Is
it more cost effective, just in all honesty, for us to go through maybe a different pharmacy?
So I talked to my wife and she said Chewy.com is fine if we want to do Chewy.com. I know we have an account. What do you need from me?
What we'll need you to do is I'm going to type this all out for you.
Okay.
But then when you get my summary, just go online and request everything in exactly what I'm sending, and then it'll send me an approval and say, hey, did they approve it? Did they send this? And I say, yes, this is Zoe, and I approve these medicines, and then they'll just go over billing and shipping, and then they'll mail it to you.
Perfect.
My question, however, is why don't we get you at least the digoxin today, since you don't have it, and that's most important.
That's what I was going to say. Is there anything prioritized? Because one dose. I don't care if I have to pay triple for it. Yeah,
no. Let's get you like 2 weeks worth here, and then just long term, it'll be best to go through Chewy. Does that sound okay?
Right. Yeah.
So do you need refill like right now? Do you have enough till that shipment comes in?
I think so. I've got a lot of, and she's going to stay on the Lasix, and she's going to stay on the other.
Your vet did a fantastic job.
It was the emergency room vet here
That's
that
right.
got all the
They're
stuff.
very good here.
So that's the LASIK, I think.
Yeah.
But the important one was that one, and we
The
have.
Vetmedin, yeah. So that's 1.5 pills. So you're going to go through 3 pills a day.
Yeah. So we've still got.
Yeah, you should. Yeah, so you go through 3 pills a day. So that's 1, 2, 3, 4, 5. You have about a week's worth. Okay. So let's make sure we kind of get that submitted to Chewy today.
Right.
That way we can get it like prioritized so you don't have to wait or anything. I know these aren't cookies.
Good girl.
Does that all make sense and everything?
It does.
It's okay. Any other questions?
No,
Does that
no.
make sense? Okay. I'm sorry. I know this isn't like the best news, but hey, at least we know, right? And at
Right.
least we have a
Well,
plan.
the only other thing was that she's turning 7 on Monday, so
Yeah.
she's a 6-year-old dog right now. Like maybe the stats are worse for like a 12-year-old dog or something like that. Maybe.
It's true, because keep in mind that prognosis includes some dogs that develop kidney failure.
Right.
Because older dogs don't tolerate all the medicines
Right.
as well because they're old.
Right. So,
That's why I said she may do better than that.
yeah.
But my goal is also just I do want to be honest about expectations,
Right.
and I don't want there to be any surprises. I do
Right.
hope she does better, okay? But
Right.
just, as I do see this quite frequently, I want to give you a kind of a realistic expectation, but hopefully let's prepare for that, and I'll be hopefully pleasantly surprised when
Right.
when we do better, hopefully.
Okay. Yeah.
Does that all sound okay?
Yep.
It's so nice meeting you today.